This study found that GPs frequently did not document safety netting advice they discussed with patients, and the likelihood of documentation was influenced by a number of consultation factors. The aim of this study was to compare spoken safety netting advice, for example, if your cough is not better in 3 weeks, or if you start coughing up blood, please come back, to the advice recorded by the GP in the medical records, and explore factors that may have influenced GP documentation practices. We used a pre-existing archive of filmed GP consultations and linked medical records involving 295 adult patients consulting 23 different GPs working across 12 practices in the west of England. Approximately 2/3 of consultations contained spoken safety netting advice, which applied to just under half of all problems discussed. Only 1/3 of consultation records had documented safety netting advice, which applied to approximately 1/5 of all problems. When safety netting advice was given for a problem, on average, GPs verbally listed 2 different symptoms or conditions for the patient to look out for, with a maximum of 11 symptoms for one problem, whereas in the medical records, the average was closer to 1 symptom, with a maximum of 4 symptoms to look out for. The individual practice of GPs varied greatly, from those that almost always documented their safety netting advice to those that never did. GPs more frequently documented their safety netting advice when assessing new problems or when they'd given specific safety netting advice rather than generic advice, and for problems that were the entire focus of the consultation compared to when multiple problems were assessed in a single consultation. In consultations where more than one problem was discussed, the later a problem was assessed by the GP, the less frequently the problem was documented in the medical records, and the less likely there was to be verbal safety netting advice, and the less likely there was to be documented safety netting advice in the medical records. Although there are pressures on both patients and GPs to discuss multiple problems in a single consultation, this study suggests GPs should consider how safely they can assess, document and safety net multiple problems in a single 10 to 15 minute consultation, and they should be shared with patients. Full results and suggestions for improvement are available open access at bjgp.org.